you talk a little bit about HER2 Zero and how that, because the talk up in, recently has really been HER2 low. And so you had to fit in that category. But you mentioned HER2 Zero. And what does that mean as far as TDXD?
Yeah, so this is something very new actually, because what happened is that in the beginning, TDXD, this antibody drug conjugate, was tested in HER2 positive breast cancer, and it was extremely active in HER2 positive. And then we kind of moved with caution toward the development of TDXD in other categories, and in particular in HER2 low. And so there was this large trial that tested TDXD in patients with HER2 low breast cancer, either triple negative or hormone receptor positive. And this trial, called Destiny Breast 04, compared TDXD versus traditional chemotherapy in patients with metastatic breast cancer, either triple negative or hormone receptor positive, where there was HER2 low expression. And this trial showed that TDXD was much more effective at prolonging progression-free survival, so the time to progression compared to chemotherapy, so worked for double the time compared to chemotherapy. And also in terms of response, there was triple the probability of response of TDXD compared to conventional chemotherapy if you had HER2 low expression. And so in this way, we kind of moved from HER2 positive toward HER2 low. And the last subgroup that we were waiting for was, and still is, HER2 zero, the last subset of breast cancer that we don't know if they can benefit from TDXD. And there was one small trial conducted in France that is called the DAISY trial. And that trial actually tested the drug in patients with HER2 zero disease. And what you can see here is what we usually call waterfall plot. This means that if you see a line going down, it means that there was a shrinkage of the tumor and so that the drug was working. And so what we saw by using TDXD in this trial, the DAISY trial, in patients that had metastatic HER2 zero breast cancer, is that there was a 30% response rate. So in 30% of the cases, you had a very promising shrinkage of disease that it's actually better than what you see with chemotherapy in this setting, because these patients in this trial were very highly pretreated, so had received many treatments before TDXD. And so we are starting to think that even if we call this tumor HER2 zero, we can actually see responses regardless of HER2 expression. And so what we know is that HER2 is actually, let's say, a continuous scoring, it's a continuous spectrum. So we started from what you see on the left, the 3+, the positive, the tumor cells that have a lot of HER2, and then we slowly moved toward the right, so the tumors that have 2+ or 1+, or even 0. And what we are seeing is that we can see responses with TDXD across these categories. The thing is that for the moment, we don't have enough data in HER2 zero breast cancer to recommend it in clinical practice. So in HER2 zero, it remains an experimental strategy, whereas for the moment, the drug is approved by the FDA. So TDXD is approved by the FDA for treating HER2 low breast cancer and HER2 positive. And these together account for more than 70% of all metastatic breast cancers. For the remaining 20 to 30% of tumors that we call HER2 zero, we have to wait for more data, but those data are actually coming, at least in part, because there is another randomized trial that is called Destiny Breast 06. And this trial is similar to the one I discussed before, the Destiny Breast 04, because it's a large trial that compares TDXD to conventional chemotherapy. And this not only includes patients with HER2 low metastatic breast cancer, but also HER2 zero. And so we hope that gradually we can expand the benefit of TDXD, not only to the HER2 positive, not only to the HER2 low, but also to what we call ultra low. So tumors that have, even if they're called HER2 zero, have some minimal expression of HER2. And finally, maybe to all the patients that have metastatic breast cancer, because maybe screening based on this core of the protein is not enough, and maybe all the patients have some likelihood of responding to TDXD and deserve to have treatment with TDXD. So it's something we are still understanding, and we are moving cautiously. And so for the moment, the only thing that are standard are HER2 positive and HER2 low. But I feel that in the future, in the next months and years, we will move toward this HER2 low and this overall category. And so we will see more patients that can benefit from this drug.